Thank you so much for joining us to meet the new leadership team at YTH. I'm Erica Scheidt, and I'm a board member, and maybe more importantly, I am a very proud board member. It's my honor today to introduce Deb Levine, our founder. Deb has been an important voice in health and sexual health for well over a dozen years. 12 years ago, Deb founded YTH, and in doing so became this important innovator in the use of technology for identifying and addressing issues of health that affect all of us, but most importantly affect the most vulnerable among us. The work that Deb and her team were doing 12 years ago, 10 years ago, was so innovative that we would say, of course you use technology in these ways. But the research and the dialogue and the projects that they were doing pushed us all forward as an industry and really changed the face of public health. And over the past 12 years has continued to innovate. 7 years ago now, Deb Levine and her team at YTH started YTH Live, which is our annual conference. If you've never been, maybe 600 people attend. From all over the world, funders, youth advocates, youth allies, technologists, public health professionals, STD prevention practitioners, just an incredible group of people come together, and we share the work that we're doing. We share the challenges we're having and the successes we're having, and we make new partnerships, and you know, it is the most inspiring 3 days. I think we all feel like we've met our people, and we're with these passionate, hardworking people that are looking to innovate and use technology, social media, mobile media, to advance health and wellness. You know, all of this is my way of saying thank you to Deb and for all the work that you do, and I'm really excited to talk about the future of YTH.
Thanks, Erica, and I'm glowing over here, and it's been a wonderful trip, and I want to also just say that our next year of intergenerational leadership with Jamia is really an offshoot of the rebranding work that we did last year. So for those of you who were around, about a little less than a year ago, so 8 months ago, we changed the name of our organization from Internet Sexuality Information Services to YTH. YTH stands for Youth, Tech, and Health. And we are very clear that we have 3 parts to our mission. And one is to go out there and discover what works in youth, tech, and health. And the second is to pilot new innovations. And the third is to evangelize and tell everybody what works out there. And you mentioned YTH Live, which is really our main place where we do our evangelizing. We also create white papers, such as the TechSex USA paper on youth sexual and digital health, youth sexual and reproductive health in the digital age. For piloting new innovations, we have so many projects going on right now, including Unete Latina for immigrant women to access healthcare and domestic violence services. In California, we have a digital storytelling project with teen, pregnant, and parenting moms that's tied into social media advocacy in Denver, Colorado. We also have those are our 2 biggest ones, where we have a few stealth apps that we're working on, both mobile. They're all mobile-driven. We are huge on the power of mobile, particularly for youth and young adults. It really was quite a long time ago, well more than 12 years, that I discovered the power of the computer screen, no matter what size, whether it's a desktop, a laptop, a smartphone, or a tiny little dumb phone, but the power of that screen to put a little bit of distance between ourselves and these sensitive issues. such as sexual and reproductive health, substance abuse, mental health, and that distance really allows us to talk freely and openly about these difficult issues and solve and create solutions to make our world a better place for youth and young adults who are maturing. I think I am going to introduce Jamia. So over the last few months, we have been on a search. We really felt that it was important as part of our new model of discovering what works and innovating and disseminating what works. And we also have a very user-centered, youth-oriented approach to everything that we do, that it was time for an intergenerational leadership model. And we did a national search and invited a number of people to apply to be the new executive director of YTH. Jamia Wilson is uniquely qualified to be our partner in crime and partner in youth health and wellness to take YTH into our future. So with that, I'd like to introduce Jamia. Jamia worked for many years as the Vice President of Programs at the Women's Media Center. You may know her from her outreach and advocacy days at Planned Parenthood Federation in New York. And she also was digital storyteller at TED and involved in the TED Prize for Innovation.
It's such an honor to be with you and to be a part of the YTH team. I am really excited to be talking about what's next for YTH because I'm a part of that and a part of YTH's next chapter. And I'm just really passionate about being a part of this ongoing commitment that YTH has to reflecting the communities of underrepresented and underserved populations that YTH partners with and also serves, and valuing that innovation that comes from diverse communities, young communities of LGBTQ youth, as well as communities of color, and communities of color that are also LGBTQ. I'm really honored to partner with Deb Levine, who is a visionary who I've long admired for her contributions and also for her fortitude and as a bridge builder and innovator with new ideas before they became popular, and really being a part of her cutting edge vision and also helping to enliven what she's imagined for the world is really an honor for me. I'm pleased to be a part of taking YTH to the next level and taking our intergenerational leadership model as a model that other organizations can use, because I'm very sure that when other people see the things that we're going to create together and how this also inspires our community, that more people are going to want to adopt this in their own communities as well. And one of the things I wanted to talk about was the connection between feminism for some people who might wonder, okay, how does this online network feminism work bridge with the work that YTH does? Is to say that I've long looked at Deb's work as a feminist pioneer, as inspiration for the work that a lot of people are starting to think about right now around how it's important for us to build proactive solutions for the communities that we serve, and why it's crucial for us to create tools and innovations and solutions that really support what we need on our own terms. So being a part of an organization like YTH that embodies so many of the values that align with the goals that networked feminists that I've been working with organizations like FemFuture as well as Women's Media Center, by creating sustainable ways for innovators to share information and tools to get the information and resources they need to build community and to strategize, as well as to create space on and offline, spaces like YTH Live, for people to come together and to share their imaginings and their learnings, are really aligned with what we've been thinking about is very crucial for the movement for gender equality moving forward, and that means all genders working together for gender equality. And I think that YTH is building bridges for that as well. And Pew actually reported in 2011 that young women, specifically young adult women, between 18 and 29 are the power users of social networking. And that was something that really inspired me. I kind of knew it in a qualitative way, but to see those numbers were really great. And there's actually proof of that that have been shown with campaigns that have been global and national reaching campaigns that have been won by using social networking tools and blogging and other internet tools to do things like end street harassment in communities, challenge attacks to reproductive rights, and also ending photoshopping of girls in magazines like 17. And all of these happened from youth-led intergenerational movements that started online and were facilitated by those sorts of collaborations. So I see YTH as a really great place for me to be, to bring my contributions, but also for me to learn and grow with this community as well, and take some of these skills and the experiences that we all have and strengths we have to really take youth health and tech to the next level, and just feel really honored to be here at this time in our history as well. And looking forward to meeting all of you who I know will be pitching us your ideas so that you can have sessions at YTH Live. That's going to be happening in April, as well as, and those are going to be due in November 27th, so there's still time, but also to meet you in person at this very fun event that really started my real deep love affair with YTH, because I already had it before, but then when I went to the first event that I attended and was a part of the community and really saw the diverse people there and the energy and saw the solution-based thinking that I was bringing back to my work, I thought about the real transformative work that we're doing and that this team is going to continue to do over time. So thank you so much. I'm really proud to be a part of this, and I can't wait to meet each of you and to learn about what you're imagining and how we're going to change the world together.
So, I was going to say, Jamia, you've mentioned YTH Live a number of times, and we have this year, we're divided into tracks that pretty much cover everything you talked about. So we have our research track, we have our projects track, excuse me. We also have an innovations track and an advocacy track. And we have so many good abstracts that have already come in. It's going to be highly competitive to really look at creating and crafting a program that leads us into the future. I can talk a little bit about some of the things that have been coming in. We have actually more global abstracts and projects coming in than we have received before, and that is super exciting. YTH has mostly been focused nationally for the last 12 years, and the opportunity really to move into the global sphere is huge. We also have a lot going on with gamification, and if we look at Ms. McGonigal's TED Talk on gamification, it is really a way that we can change the world for everybody. And there's also a lot of push around coding youth, so youth who code, and really trying to both create job resources, economic justice, and going into our most vulnerable populations of young people and teaching them how to code and giving them the tools so that they have job security and also can be our social entrepreneurs of the future around youth health and wellness. There is so much going on in mobile apps. It is just blowing up right now. And then the other thing that's been really interesting is this cross-population of topics, from sexual and reproductive health, but also their interaction with substance use and abuse, mental health, depression, suicide, and homelessness.
We had one question yesterday, I think from Jessica Ken, who is a public health student and worked here for a little while and sort of, I think, wishes she was in the room right now. And her question was for both Jamia and Deb: where do you see the organization in 10 years?
Yes. So I've been thinking a lot about this, and I think that we're already moving in that direction of where I want to see us, but I really want to see those young people who start doing this coding work with us and who are starting to do that now, starting to already be those entrepreneurs and seeing the fruits of their labor. I think realistically, within that 10-year time, we'll be able to see a cycle of people who receive that training, support, and also connection being the builders who are mentoring the next generation. So that's something that I definitely aspire to as well. And we were kind of talking about this yesterday, to see that, you know, maybe the next Zuckerberg would be the next person with a name like Jose or Jamia who would be creating these innovations. And that would be wonderful, and I think that that's something that YTH will be a part of, surely, mark our words. But yeah, we'll be modeling an intergenerational leadership model, and I really do believe that we are going to see other organizations adopt this as well, and they're going to see that not only is it important and something that's strategic for them to do, but they're going to see that it's necessary for them to be able to serve the people who need these services with the right information and also the trust and credibility. In an increasingly connected, social media-driven world, people really, really rely on relationships, trust, and authenticity. And I was actually just listening to a panel yesterday about what will it take to have the next woman president, was the question that was being asked. And this amazing young social entrepreneur, Julie Zeilinger, who started out doing a blog called The F-Bomb, using technology to raise her voice, and has gotten a book deal out of this and other things, was saying that she really believes that her generation needs to see more authenticity in leaders. And I think that this sort of model and this sort of authentic work that we're doing, and honest work that is about being a trusted resource but also partnering in a collaborative, listening and also responding model, is going to be something that we're going to see more of, and will be a much more inclusive and collaborative movement as well. And I think that by having this sort of model and this sort of diversity within the leadership is going to change the overall culture of tech, and we're going to see a lot more young people and people of color in these leadership roles, in health tech specifically, which is now more male-dominated and more white male-dominated.
Mm-hmm. Absolutely. This is fun. This is amazing, and what I think has even been more empowering is that we have, through our pilots, we have had these incredible successes, and so many organizations turn to us to ask, how did you do that? What did you do? And we create training manuals, and we create resources, and we're really able to go out and say to people, hey, you know, we can save you 3 steps. Do it this way, don't do it that way. If you do it that way, X, Y, Z will happen. Boom. Okay, do it this way. And so that basically other organizations are able to take the groundwork that we've laid, they're able to scale and replicate projects, and they're really able to move forward much more quickly based on a lot of the innovation and experimentation we're doing here at YTH in Oakland.
Absolutely.
So,
and I think, Deb, you spoke about gamification earlier. We have a question here from Brian Hayes saying, I've been waiting for the CDC's contest, Game On, HIV, STD prevention mobile application video game challenge to start. And ask, is YTH involved? Is YTH involved? And registration is open now. Does can we address that, the CDC contest Game On directly, or talk about any of the gamification that's happening, especially in HIV and STD prevention?
Sure. I think what's really interesting is challenge.gov, and if you're not familiar, go to challenge.gov. The U.S. federal government is posting challenges almost every day. The challenges are to create technology solutions that really advance our nation's our nation. And in particular, the NIH, the CDC, and also the White House special offices have really put forward challenges to advance our nation's health and wellness. I'm actually not familiar with the HIV STD prevention mobile app video game challenge. It sounds a little like they want everything all at once in one challenge, and in one app. They want a mobile game, they want a video, they want an app. And that's, you know, don't we all want it all? And I love that. But it looks like if you have a project and if you're out there listening, this would be a great time to get your partners together and collaborate and enter the challenge. It really is the perfect fit for the YTH Live audience. We at YTH have been more involved. We won. We have won one of the government challenges together with a team that included. Let's see. Christine Corbett-Moran and Nancy Schwartzman and Thomas Kaboo, that we won the Apps Against Abuse Challenge with the Circle of Six mobile app to prevent dating violence and sexual assault on college campuses. And so the challenges are super fun. We really encourage people to get involved, and we'd be happy to start pushing out the registration for the CDC's Game On.
That's great. I have another question here. It's for Jamia. What has been the narrative or the through line of your work that led you to work with YTH?
You know, I think that really it's about solutions. The point of departure for me has been collaboration and solutions. And the movement that I've seen where I really think that I contribute my strengths the most is that I really have learned that being proactive and solutions-based has been what felt most personally fulfilling for me in the work that I've done and the variety of organizations I've done, but also what I think has been most effective. And waiting sometimes for change to happen incrementally and expecting those sorts of things to happen within culture and policy without coming up with some of our own practice solutions first doesn't necessarily make things happen as quickly as I would like them to be. And I heard something said yesterday about how millennials tend to turn things around a lot faster because it's a part of the ethos that comes with all of the tools that we're using. But I do think that that is something that I've really admired in YTH's work, and that partnership ability, that leaning in, and it's funny that I'm even using that phrase, leaning in to say yes to partnering, to say yes to collaborating, and to say yes to finding a solution to things and experimenting. And that's something that I hadn't necessarily seen as the most of in terms of older leadership models around grassroots organizing. And that's something that I think that social entrepreneurship really brings. And so I found myself in my free time a lot gaining those values and seeing those in the community happy hour experiences I was having with other young people who, and I'm aging myself a lot when I say this, were starting to do things on Twitter, or starting to do things on on MySpace and Friendster way back in the day, and Black Planet, which is something that someone brought up yesterday that really made me laugh.
I remember Black Planet.
Exactly, and a long time ago.
Mi Gente, that was the Latino social networking site. Love it.
Exactly, and I remember that in my first live journal and using those for social change and talking about those things in these offices that I was in. People were kind of wary about the privacy and security issues around that and worried about what it might mean, and now seeing these absolutely as necessary components of doing the work. So the through line for me has really been seeing that the solutions-based thinking, the experimentation, and the willingness to take risk that comes out of this sort of community is what really attracted me to YTH. And then also the opportunity to be mentored in a role in an intergenerational leadership model was something that I've been really craving and looking for in terms of bringing in my strengths, but also working with someone who has that experience and skin in the game and ability to help push me and lead me in that way. And so that's really the several through lines that brought me here. But then also the community, and also hearing from other people in my community that they were also wanting to see more young people and young people of color stepping up and taking these roles. And so for me, I believe it's also something that is important for me to do, to really live the things I've been talking about for so long, and to put myself out there in a role of leadership and responsibility, and to say, yes, we can do this, you can do this, that now is the time to lead, and you don't have to wait until you get older or for next year. Now is the time. Yeah. You have what it takes, and you have within your community the resources you need for that support.
Right. And I would just back up Jamia to say that it's not just me, but she has the full support of our board of directors, including Erica Lorraine Scheidt, who's on with us today, David Goldsmith from Dacia, Matthew Holt from Health 2.0, Dr. Jeff Klausner at UCLA, Dr. Margarita Lightfoot at UCSF Center for AIDS Prevention Studies, Emily May from Hollaback, Stuart Ugaloo from Teach Fishing. We have the most absolute incredible working board of directors and staff. Our staff and contractors on average have been with us 4 to 5 years, which is highly unusual in such a fast-moving and fast-paced field. And everybody is just committed to staying on the cutting edge and to working together to really advance youth health and wellness using technology and mobile. I also want to say, so way back, Erica, you asked about 10 years from now. Yeah. I'm going to go with 5 years from now and say this past year I was voted one of 40 women over 40 to watch, and within the next 5 years, Jamia is going to be one of 40 under 40. So
Thank
that's
you.
my plan.
Thank you so much. I remember when you got that and was really inspired and excited about that as well. And thank you so much for believing in me. I'm really excited. I actually was just thinking about even the kinds of questions that we're asking ourselves internally. It was really a delight during my interview process with the board. One of the things that really inspired me more to really want to give so much into this and into the process was that I really enjoyed the questions that the board asked me. And I thought that if this is the kind of organization that are asking these important and critical questions, then this is where I want to be, because I'm someone who really believes that we find the answers in the questions. And that was something that this board and Deb give. So, and I think that we invite that from the community of people who also attend YTH Live as well.
That's fantastic. So I'll use that moment to encourage any more questions using the hashtag YTH Live. We have a question. This is for both Jamia and Deb. What are some of the most urgent areas that you want to bring the resources of YTH and its partners and its funders to bear on? What are the most urgent areas that you see facing us in health and wellness, sexual health?
Ooh, urgent. Okay, first thing top of mind right now for me is homeless youth. Incredibly homeless and unstably housed. They're really in a very precarious situation. Our healthcare system is failing them. They don't have disposable income, so there's not a lot of innovation happening to help them connect with vital health services, including HIV testing and screening, and planned pregnancies, as well as clothing, food, and shelter. So I've got homeless youth on the brain at the moment. I think that some of the other pieces are really about job security, economic justice, and really working with youth themselves to solve some of these problems, giving them the tools and the training so that they can really move forward and solve these problems. So I'll pass to Jamia with that. You might inspire me.
Absolutely, I agree with all of those things, and I've actually been thinking a lot about homeless LGBTQ youth in New York and some of the organizations that do that work here, and think what you said is absolutely true.
Okay, we're sticking with homelessness and homeless youth. And then we're going to look at internet access and technology for all. I do think there's something about, you know, our internet, and this is not to, you know, to make fun in any way, shape, or form of our technological glitches today, but really to say that mobile is the way to go, that right now accessing the internet via mobile phones is much more consistent, it's much less expensive, and it's a much easier way to reach youth and to connect with youth and to support youth moving forward. So if our evidence of being hardwired today is any showcase, mobile's the way to go.
I know that Deb has already talked a little bit about the abstracts we're receiving for YTH Live 2014. I had some questions just sort of previewing other topics that we're going to talk about. We are going to wrap up here in a bit, so if you have any last questions, just let me know. You can do that with hashtag YTH Live, or if you're signed on with the question box, if you're signed on at Google+. I think we're still frozen there. I did want to say on the intergenerational leadership model, we have a really active youth advisory board, and these young people are phenomenal, and they are not an advisory board in name only. They have a huge role in both developing the programming and participating in the programs that we're doing. I want to call out Anthony Siss, who I'm so excited is staying on for another year. This is a kid to watch who's just doing incredible work and will be at YTH Live 2014. Go ahead, Jamia.
Oh,
hi, I'm so sorry.
No, it's okay. And Erica, just to sort of play off of the advisory board, so we just announced this week our new advisory board members for 2013-2014. So please go to yth.org/blog, and you will see the most amazing group of young people we have assembled from across the country to work with us moving forward and make sure that we keep our adult board of directors in check.
Hey, so I wanted to say that just before about the important, urgent issues, because I really care much about that question, is that I think mental health is extremely, extremely important and timely. It's always been an important issue, but lack of access, especially for young people, and also just as a writer for teen publication Rookie Magazine, rookiemag.com.
Okay, thank you. I think this is probably a great time to sum up. So, Erica?
Yeah, absolutely, and I'd like to wrap up at a time when we can all be heard, because this has been really fantastic, but it's not a conversation that ends with this Google Hangout. You can reach Jamia on Twitter, you can reach Deb Levine on Twitter, you can reach YTH on Twitter, you can email us, call us. We're doing work in the community today. We have extended the deadline for the abstracts until November 27th. So if you're doing innovative work in research, innovation, advocacy, health and wellness, reproductive rights, feminism, sexual health, we'd really like to hear about the projects that you're doing. If each of you could tell your Twitter handle and say goodbye, we'll go ahead and close up.
Sure, Jamia?
Thank you. You can always find me on Twitter at Jamia, Jamiaw for Wilson, and I look forward to being in conversation with you and meeting you in real time. And thank you so much for your passion and commitment to young people and advancing their health and wellness.
Thank you. And you can find YTH on Twitter at YTH.org, and I am on at Deb YTH, and really truly you need to be on our website to get consistent updates for around YTH Live and everything else we're doing at the organization. So always you can visit us at yth.org, read the blog, look in the Now section for Live 2014. And sign up for our newsletter, sending it out every month with, just the pacing and lead up to our 2014 conference. Thank you so much.
And YTH, we're headquartered here in Oakland, California, and Jamia is going to move out from New York. And so, Jamia, welcome to one of the most incredible places in the United States. We're happy to have you in Oakland. Thanks, everyone. Thanks for participating.
Right. Thank you.
Thank you. I can't wait to be there. Can't wait to join you.